he would get better, get discharged, come back for the same, me get better, me not get better, get discharged, come back. So it's a cycle. So it sounds like a slow death. So at that time, family decided that since he doesn't even know that where he is. He has no life actually. He's just a living body that's just sitting there, and they thought that it might be, more pain for him than the being plight of being alive. Or
that is a different state. What I meant was that one of your friend who's refusing
Yeah.
dialysis, that I'm saying is that he's acting out of pure ignorance. He's not understanding the magnitude of the life as a blessing on its own, that make use of every day. And a couple of weeks ago, there was a quoting that Hazrat Ibrahim alayhi salam became very sick, or maybe Hazrat Musa, I don't know. Sometimes I forget the things that go across me. And the doctor came to treat him, and he said, I don't need no doctors, you can go, Allah is going to cure you. Allah said, I was the one who sent the doctors to you for this cure. Make use of it. So yes, that all these sciences are from Allah. All these medications and these inventions are for us. Otherwise, why would people find out in Wisconsin, was it in Wisconsin or where they found the blood thinner warfarin? There's a blood thinner named warfarin. This is how they found out that there were cows that were used to pasture in the fields.
Coumadine.
Coumadine, right?
Yeah. Mm-hmm.
And they were used to pasture there, and all of a sudden they just started to bleed profusively, and they just died. And they came up and they found out that in the grass there was that typical ingredient that would cause the blood thinning.
Mm-hmm.
So Allah is the one who is giving these things for us to realize them.
I personally think that all of these questions are so sensitive that answering them in discrete yes and no might not be very appropriate. That's my personal thing. But coming back to in case when somebody's, let's say, 50 years old person who has just kidney failure and needs dialysis, in that case, I think a physician has to play his role in telling the patient about the usefulness of hemodialysis. But look at the other side. If it is 95 years old man, right, who has, for example, pancreas cancer, which has spread to the brain, lungs, bones, and everywhere. Well, nobody can tell when somebody's going to die, but the expected life expectancy is less than like 3 months. Then putting this patient to hemodialysis may be kind of assault on this patient. So I think it has to be very customized thought process. If that was just the only problem, dialysis, then the guy can be convinced about it.
Yeah, patient specific. It has to be patient specific.
Yeah, human body is a miracle, So my body is different than yours, although we look like same. I would respond differently than yours, and you think differently than what I am. So it's a miracle of Allah.
But there are certain broad guidelines,
Yes, I mean
those
the
broad
purpose of
guidelines.
discussion was. I brought this up because, as a Muslim physician, now this hospice was supposed to be a service who was taking care of patient dying of end-stage cancer. Now, hospice means comfort bearers, and they admit all heart failure patient or the patient which I told you, this kind of patient, in which the plan is not to pursue the therapy, but for comfort care, and the life expectancy is less than 6 months, or in my case, when somebody gets admitted, less than two weeks. Yes, if you think that somebody has life expectancy less than 2 weeks, do they die always within 2 weeks? Not necessarily. I know patients who was extubated thinking that they're going to die in the next 5 minutes, and they lived years after that. But Since it's a part of my job description that I have to cover these kind of patients in service, which I never felt comfortable. So that's the purpose to find out that since it's a part of my job description, how should I just refuse to cover the service, or can I do something within my own limits, or whatever, to clarify a few things. And I don't think that there has been much detailed discussion about this topic, end of life care. Yes, clinical death might have been discussed, or withdrawal of the care, but since hospice is very new, so it's not much discussed.
A lot of gray in this. It's not yes and no situation. There's a lot of gray, and variation individually would be there. Okay, but for a physician's job, the first would be to cure the patient. Okay, that's why they come to you. Okay, because they are diseased to cure. The second would be the comfort.
So I cannot cure anybody.
Okay.
That's for sure.
Yeah.
I can help them in getting better.
Yeah. Okay.
Right. Cure is not mine.
Yes.
No,
So in your specialty, say the cure is not there, but it's to make them as comfortable as possible in the last days of their life. Okay, that's the end of the life treatment. Okay. Then if the patient comes to you, and assumption is that he has 3 months to live, for example. Okay, as you said, that cancer has spread, all over his body. He has 3 months to live. Okay, would you go for chemotherapy at that time, or would you just give him morphine to just get rid of his pain?
Now the question is, if that's a 50 years old person who has spread cancer, and you want to take a chance that that's fine. Yeah, I might die 3 months without the medication, but I might live 4.5 months with the medication. I want to go with that. So yes.
So then you will put the patient's opinion into that.
Yeah.
You will consider the patient's opinion. The patient is 95 years, that as you gave. Okay, there it's an open and shut case because you see it that way. But suppose a patient comes to you, going back on what she said, he's 50 years old. No, he's 45 years old. Okay, and he is physically seems to be okay. Okay, otherwise okay. Okay, the cancer has spread though. Okay, and from tests that he may not survive much more. Okay, he tells you 3 months is enough. Okay, you give him the bad news that you may survive for 3 months, but if I give you these drugs, if you go for chemotherapy, maybe instead of 3 months you'll survive 6 months. Okay, or more. But these are the side effects of these drugs. Okay? Or he knows the side effects of these drugs. Okay? What do? He says no. Okay? There are equal chances of him because he is muscular, his body, can withhold, for example, the side effects of the drug itself. Okay? Do you force him to have medications?
No, even if I want, I cannot.
No, I'm just as a...
I can try convincing it if I feel that that's going to help him.
Mm-hmm.
But in general,
of course, as long he's living and as long he's making decisions, no one can force him in this country.
Yeah.
Okay, force is not allowed legally, so you cannot do that. But there is chance that if he takes the chemotherapy, he may survive for 6 months or more. Okay, and you have convinced him. Okay, completely. Okay, and he still refuses.
The answer is no.
Okay, those, of course, these are a lot of different situations, and you may have experience of either of these cases, it is there, and as this form of treatment is new relatively, okay, much more has not been written on it. Okay. You may be the first one to, point it from the Islamic viewpoint, but that's what it is.
Yeah, there are not many of Muslim patients which I encounter, but in general, there are a lot of Muslim physicians in this country.
Mm-hmm.
So I don't know how other people think about it, but I never felt comfortable.
Well, I think, in Imamiya Medics and other organizations, there is one Pakistani organization, Imamiya Medics IMI, okay, that's Shia organization. But General Muslim organization is there, Apna.
Isna.
No, up for medical professions.
Apna, that's Pakistani physicians.
Pakistan physicians.
Yeah.
Okay. That, but they also have not discussed this.
Ups.
No, they have not discussed this.
Apna is more interested in music functions.
Yeah, it's a good social club. No, it has not been discussed. Imamiya probably would, because they have discussed clinical death once. Okay, so this may be something that would be discussed. Inshallah, we'll have some more discussion on this.
But before we conclude, just one more question about the thing you said, that once somebody comes and intubated, one should not withdraw the support, even if the family or healthcare proxy is there. So does it apply similar to Muslim and non-Muslim patients?
The question was asked regarding Muslims.
No, I think I asked for both.
No. This question where this fatwa came was asked regarding Muslims.
So now
But it will be general, probably, apply to both.
No, if it's non-Muslim, then I'm bound. So I'm kind of sandwiched between two things. One is religious laws or recommendation, or the is the law of the land. So law of the land tells me where I'm working is to follow
the proxy,
the
for
patient's
example.
wishes. Then what should I do at this point?
If a non-Muslim is there, okay, because that issue is not in their, religious way, you can tell them, okay, that if you want, I will take it out, for example. Okay. If Muslim is there, you will have to tell the proxy that, Islam does not permit this. Okay. If even after that they make a decision and some other doctor does it, it does it. Okay.
But even that's a Muslim family and I'm the only physician and they just want, all the Muslims are not that practicing, so sometimes they don't bother much about what Islam says. In that case, should we just deal with them as if we are dealing with any other sector of faith, like
a gray area, very gray area.
They are supposed to be Muslim, but they are not practicing, and they don't care about what.
Yeah, that would be like some others, but it's a very gray area. A very gray area. There's no clear cut, answer to this. Needs a lot of more discussion between ulama themselves, At what do we do in a situation where the physician is a Muslim, okay? The patient coming to is also a Muslim, but they're not practicing Muslims, okay? We inform them that taking out the life support system is not permitted once the support system has been put, but they are still insisting on that, okay? What is the choice? You cannot refuse the law of the land where you live. Does it overrule this particular law? Something that has to be, discussed. And you are the only physician. Suppose there was another physician, you may allow.
You can hand over the care to somebody else.
Yeah, you can give that care. Yeah, but suppose you are the only physician, what do you do?
Or the other one is also Muslim, or refuse to help you.
Yeah, the other one is a Muslim, refuses to help you. Yes, these are questions.
Your job is just up to 1 minute.
Yes.
That like Prophet Muhammad when he was immigrating and propagating Islam, his job was to deliver the message. Then it's up to the people.
Eventually, you cannot force the decisions, okay, based on your assumption of beliefs, okay. Eventual decision would come from them, definitely, okay. How much can you influence them? How much can you convince them? Of course, you should, okay. But other than that, eventual decision would come from them. Okay.
We'll have more discussion about these things.
Yes, we'll have more discussion about these things next week, inshallah. We did spend good time on it. I wanted to cover a couple of topics on Tawheed. before I conclude today, because next week, you know,